Every patient encounter is either a transaction or a transformation, and the difference is very simple. It's the education that happens at the table. Think about your best patients, the ones who finish care, refer friends, and stay connected. They didn't stay because they were sold anything. They stayed because someone on the team helped them to understand what's happening with their body, why the plan matters, what results require next, what tools we have to speed up their outcomes. That doesn't happen from a brochure. It happens from 30 to 60 seconds of table talk from the provider, the rehab technicians, and every team member for that matter. When we educate, we don't pitch. We create value, build trust, and help patients see the next logical step of their care. Starting this week, I want you to do education as part of every single encounter in your office. Your goal is simple. In every visit, connect the patient with one of these things: their diagnosis, why today's visit matters, their goal, what's the next phase going to require of them, their progress, what will accelerate the results, their symptoms, what other services support it. This is a way to promote. We don't promote services to increase revenue. We educate to increase outcomes, and continued care becomes a natural decision. So now you'll have people moving from a corrective phase into the wellness care. We won't want people to stop and think this is the end of it. People don't stop having stresses in their life, whether it's physical, emotional, or chemical. So make sure that you're using table talk to educate your patients, to build value in your services, and let them know about any additional services that maybe weren't recommended in the beginning or were not taken up because it was a budgetary thing. So there are some scripting that we can use on that. Weekly practice training tip: one visit, one value line. Every team member delivers one short educational line per encounter that links the patient's goal back to the next best service. This 3-step table talk script is going to help you. 1, validate. That's exactly what we'd expect with. So we leave it blank there, as a person may say, hey, my back pain's increased. That's exactly what we'd expect with this treatment. Next would be to educate. That happens because blank. That happens because we're opening up areas that have been locked down for a period of time. Then we're going to move into the bridge. That's why we also use blank, which could be laser, interferential, decompression, to help you blank faster. So to help you heal faster, move faster, increase range of motion faster, get you back to doing the things that you love to do. So I'm going to go back over that very quickly. So this 3-step to table talk is validate. That's exactly what we'd expect with you just beginning care. We educate. This happens because those areas have been locked down for a long period of time. Then the bridge. That's also why we use interferential as part of your treatment plan, which is going to help you heal faster. So please remember those 3 tips is validate, educate, then the bridge. So some examples, maybe for your providers. Your nerves calm down when we reduce inflammation and improve motion. That's why laser can help speed that up. As far as the rehab technician, these exercises train stability. When you pair that with decompression, you oftentimes see faster relief. At the front desk, your progress is great. Your next step is keeping momentum. That's why we schedule out all of your visits right now today. So the team standard is if you did this, but you didn't explain the value, you left results, opportunities, and retention on the table. So education should be a part of every single encounter. Table talk. whether that's with the nurse practitioner, the chiropractor, the DC, the case managers, the front desk. It doesn't matter who it is. Everybody needs their educational line. It helps bring value and creates retention for your practice. So let me recap this here. Team quick training for this week. Table talk is part of every single treatment. Every single patient encounter is an opportunity to educate, and education creates value. Here's the truth. Patients don't continue care because we told them to. They continue care because they understand what's happening, why today matters, and what the next step is. So starting now, I want you to use these 3 simple steps in table talk. So we're going to recap those here. Validate. That makes sense based on what we're seeing. Educate. Here's why that's happening. Bridge. And that's why we're also using blank to help you blank faster. So how this sounds all wrapped into one is your back pain is connected to the inflammation and the restriction in range of motion. That's why today's adjustment matters. And adding laser can help calm the inflammation so you can heal faster. This is not selling. This is leadership. This is outcomes. This week, every patient gets 1 value line from you minimum. After your next 3 patients, ask yourself this: did I educate? Did I connect today's care to the next best step? Let's make education the standard, because results and retention always follow value. We'll see you next time. Be blessed and be a blessing.
If this helped, give this video a like and share it with someone who needs this.